Discussing the results of the phase 3 NETTER-1 study. We were fortunate at Cedars to enroll a lot of patients onto the study, probably the second highest enrolling center in the US. And we've been very fortunate to be a part of this important treatment and breakthrough. So here are the phase 3 results, progression-free survival, radiographic response, and overall survival results in patients with mid-gut neuroendocrine tumors treated with lutetium dotatate. So as we discussed today, there are limited therapeutic options for patients with advanced mid-gut neuroendocrine tumors progressing on first-line somatostatin analog therapy. Thousands of patients have been treated with peptide receptor radionuclide therapy with promising results. This extensive experience includes several patients treated at many European sites that have already been discussed, with impressive progression-free and overall survival benefit. So in this study, we evaluated the efficacy and safety of this agent with and serotonin symptom control compared to octreotide LAR 60 milligrams in patients with inoperable somatostatin receptor positive mid-gut neuroendocrine tumors that have progressed on standard dosing of octreotide LAR. This was an international multi-center study that was randomized, comparator controlled, and parallel group. And if you see here, there are 4 doses that were given 2 months apart in the treatment arm, and in the control arm, octreotide LAR at 60 milligrams was given every 4 weeks. The primary objective was to look at progression-free survival, which means how long did it take for the tumors to grow after treatment with lutetium dotatate with 30 milligrams of octreotide LAR versus treatment with the high-dose octreotide LAR. Secondary objectives included objective response rate between the 2 arms, looking at overall survival in the 2 arms, time to progression, safety, tolerability, and quality of life. So the inclusion criteria, which is important because it probably will be on the FDA label, is that patients greater than 18 years of age, the metastatic, locally advanced, or inoperable mid-gut neuroendocrine tumor, Ki-67 less than 20%, progressive disease on octreotide LAR, and that it should be somatostatin receptor positive. Now, if you look at the 2 groups of patients, 116 in the lutetium arm, 113 in the control arm, they were quite balanced in as far as gender, age, BMI, primary tumor site, and sites of metastases. And this is on purpose. This is by study design. They're also similar in the distribution of grade 1, grade 2 disease. The patients who had somatostatin receptor positivity, grading between 2 to 4 on the Krenning scale, the chromogranin A levels, as well as this urine 5-HIAA. And as been shown earlier today, there was just a remarkable improvement with this disease over the double dose of octreotide LAR. So with this treatment, the progression-free survival was improved. The hazard ratio was 80% reduction in the risk of progression. And the estimated median progression-free survival is about 40 months, which is quite remarkable. And this is a question that we saw on the question card, so I can get this question answered right now. What is the likelihood of having a response, meaning the tumor shrinking with PRRT? And here you see that the answer is about 18% versus 3% on the sandostatin LAR. But the majority of patients have what's called stable disease. When you look at the two arms, 5% of the patients progressed with lutetium, and 24% of the patients on the standard treatment progressed, or on the double dose octreotide progressed. So what's really also great about PRRT is that the majority of patients get their treatments. It's not like that with all treatments. I mean, a lot of cancer treatments, they have a significant number of side effects, so you don't expect for them to receive all the planned therapy. But for this treatment, there was. About 77% of the patients received all 4 treatments, which was remarkable. And as far as dose-modifying toxicity, only 5% of the patients had a toxicity that would require a dose adjustment. Again, this is for chemotherapy studies and other types of studies for cancer, this is unique. And safety and tolerability, this medication has been proven to be very, very safe. Now, these are all the side effects while patients are on the treatment. Again, I don't think it's valuable to really talk about it. There was some diminishment in platelets and white count and red blood cells, but not significant decreases where it would affect treatment or quality of life or any other issue. So overall, very well tolerated. So this is liver toxicity in this treatment. Only 4% of the patients had an increase in AST or ALT, 2% with the bilirubin increase, and 18% with the increase in GGT. Again, this was not changing therapy or deemed to be very clinically important. And the one thing that was quite concerning in theory and when we started the treatment was to protect the kidney function. And here we see that versus LAR, double dose, there wasn't any real effects on kidney function that were significant, which is great news. So to summarize, this is the first prospective randomized study in patients with progressive midgut neuroendocrine tumors. Lutetium was superior to octreotide, 60 milligrams, as far as progression-free survival and overall response rate. The interim analysis also suggests that people are going to do better overall on this treatment, that lutetium dotatate is very safe, which is reassuring. And I think one of the amazing things about the treatment is very safe. Almost all the patients complete the therapy, which is remarkable. And for this unique patient population that doesn't have a lot of options, this is a really important new medication.